Hi everybody, I'm here today with Dr. Akash Mavani, who is the lead dentist and owner of Allure Health. And he's coming to see me today with a variety of aches and pains. Do you want us to explain what you've got today?
Yeah, so I suffer with chronic neck and back pain, and currently at the moment it's gone down shoulder, arm, legs, pretty much the whole body.
The whole body?
Yeah.
Okay. And it is worth pointing out that you've had a fair amount of quite an interesting history of your neck over the years. Do you want to elaborate?
So in 2000 I had decompression surgery for an arm Chiari malformation. Mm-hmm. It's kind of where your brain's stem is stuck in your spinal cord. So decompression surgery is where they extended the foramen magnum, chipped away a little bit of the vertebrae to make space. Yeah, so the recovery from that's been quite bad with the muscles all falling back quite tightly.
The foramen magnum is the main hole that your brainstem sits through, so that was too tight essentially.
Exactly. Yeah.
Didn't you had a syrinx as well at all?
So yeah, so a syrinx, so there wasn't any fluid down my back basically, causing headaches, migraines, nausea, vision issues, quite a few.
So much like how we have blood that circulates the body and blood vessels, you have cerebrospinal fluid that circulates the brain, the spinal cord, and that was just disrupting that flow. Did you have a pouching of the, or not? It was so you had the actual pouching. So the syrinx is where essentially the fluid pushes out and causes a little bulge, and that can push on the brainstem, can push on the spinal cord, and that creates a whole variety of symptoms, which makes it very, very difficult to diagnose as well, because it's different from person to person.
It was just diagnosed as headaches as a kid.
And then you had the surgery, and this is on your upper vertebrae.
It was. Yeah.
So those are the areas that we have your history. We know we pretty much stay clear of those, aside from maybe a bit of massage, soft tissue stuff, nice and easy stuff. But it's also worth pointing out you've had manual therapy many, many times. We know what works well for you, what doesn't work well for you, and you've also had an MRI not that long ago.
Yeah.
How long ago?
About 2 weeks ago.
2 weeks, and that was again just to double check the neck.
Yeah.
All okay, so that's one less thing we can worry
That's
about.
all been taken care of.
And is also the reason for a lot of you who have come in to see me already. We know that the first session especially we do a big case history, thorough examination, and that's to rule out any possible adverse events, any issues or risks that might be involved, to identify things like this. Anyway, alright, so with all that being said, ready to start, yeah? Excellent, good, thank you. Which side do you tend to struggle with mostly? This one, yeah? Okay, if you're able to just push out towards my hands here as hard as you can, that's it. How does that one feel? Okay. Easier?
Bit of pain here.
Bit of pain there. Okay, right. Sit up nice and straight. If I just put pressure down the top of your head, any pain, any discomfort, apart from my shoulders clicking there, down there, yeah? Okay. You okay there? Any soreness? Alright.
Just very tight.
So really tight around this one, isn't it? Yeah. Take a deep breath in and then all the way out. Flop the arms, good. There we go, well done. And do one more. Deep breath in, all the way out, please. Good, good, good. Good. Okay, if you want to bring the knees back up if you need to. Feeling okay there? Yep. Yeah. Gently push back this way. If it gets too much, either just ease off or just let me know, okay, and we'll stop. Relax. Push. Good. Feeling okay?
Yeah.
Sore? Yeah. Okay, so we've just finished our first treatment. How are you feeling?
Much better actually.
Bit beaten up or not too bad?
Not too bad. It's just nice to feel loose again.
A little bit loose,
Yeah, it just feels bit of pressure's off, which is nice.
So it's a step in the right direction. We've already said we're going to need at least another couple. We've agreed on 2 more treatments just to get the ball rolling to see how it feels. We'll reassess. Yeah, we're going to go over a couple of exercises next time probably. as a dentist, everything's very much focused on the forward shoulder posture. This is the issue. We need to try and stretch it all back, get these back muscles working a little bit better. So we'll go over that next time. Do a couple more sessions, reevaluate every time, and on that third session we'll see how you're feeling. Yeah? Excellent.
Sounds good.
Good stuff.
Thank you very much.
No worries.
Nice.